you need a good indication. And one of the things is obviously understanding whether it's a partial tear or full tear, and management can change for both things. Again, some people would say, well, partial tear, can we just carry on rehabbing? And yes, you can. But then you can go the other way as well and say, actually, for a partial tear, you may want to continue and actually still have the surgery. So again, one or two ways. Some people would say for a full tear, we don't need surgery, just leave it the way it is, and that's fine. And then going back, it's a full tear, let's have some surgery. So it all depends on the person in front of us, because that's the most important decision that we're making, is that the person in front of us understands what we're about to do. Yeah. So this is something that you've basically done not too long ago. That's the sort of bicep, and then
so that's the biceps, and that's the implant I am personally currently using, which is the Alpha Extensor Button. It's basically an implant which allows this implant gives has a doesn't allow the tendon to tear. You need to have 5 times more force applied to the tendon for it to fail. So if a biceps tendon fails at 100 newtons, this implant fails at 500 newtons. So it's a very strong implant, and it allows you, as you can see, you have to drill a tunnel into the insertion of the tendon or to the radial tuberosity.
Yeah.
The tunnel, as you can see, is bigger proximally because it allows you to drag the tendon into the actual bone. You see, and this is the actual animation of the technique I am using. It's a simple technique, reliable technique with very few potential complications, which works perfectly well in my hand. Other surgeons prefer other techniques, but this is my single incision technique that I'm currently using for the distal biceps tendon tears.
Yeah, so that small little white thing that you guys saw on the X-ray essentially is what Dimitrios basically uses to kind of place under,
correct,
turn it, and then sort of obviously use suturing skills to kind of like make sure it's intact. And if you think about it, 5 times the actual force. So, you've got a very solid structure there. And I think this is where the confidence needs to improve for patients to understand that it's not just going to rip all of a sudden. All right. Now, what I'll do is I'll stop that share and then we'll go back to the sort of presentation. But this is just to give you an idea of the sort of level of technology advancements that have happened as a result of just years and years of sort of, biceps research. And then more than that, just the surgical techniques have improved.